Hey y'all, this is Dr. Carmen Corder with thedoctornurse.com, and I have my husband Michael here with me today. We are going to do a video about the health assessment because so many of y'all have asked for some videos covering health assessment, so we are going to start that series today. The parts that we're going to cover today are called the general survey and the subjective data. Alright, so the general survey is basically the snapshot judgment that you make about your patient as you first enter your patient's room. Okay, there are a lot of conclusions you can make. You can determine pretty much if that patient is what I call sick or not sick just when you first walk into the room. So when I walk into the room to assess my patient, I'm looking around the room first. I'm looking for the number of IV pumps. I'm looking to see if my patient is on any oxygen. And if they are, I'm looking to see how much. Alright, so I'm looking at Michael here, and he is not on any oxygen, so he's on room air. Alright, I'm looking at his skin color. It is very appropriate. It is not pale or anything like that, like, you know, or blue, which would be even worse. I'm looking at the way that he is sitting in the bed and smiling at me. He is sitting up in the bed, or actually he's sitting in the chair. So that gives me another piece of information that you as a student need to file in your filing cabinet, that this patient is up in the chair, so they're able to get up into the chair. A patient that's sitting up in the chair obviously is probably doing better than someone who's lying in the bed. I'm looking at the IV site, and I'm looking at what IV medications the patient has going. Michael has no IV medications, so I'm going to say that he is not nearly as sick as my patient next door who is on a cortisone drip because they're continuously having PVCs, right? I'm also going to make a snap judgment about, does he appear to be in any kind of distress. Alright, if you walk into a room and your patient is sitting over in the tripod position and, you know, they're breathing like this versus a patient that's sitting in a chair looking like this, sick versus not sick. Alright, so he's in no apparent distress. His skin color is good. He's calm. That's another thing. You can really quickly decide whether or not is your patient anxious, because anxiety, restlessness, those are the first signs of hypoxemia, right? So Michael does not look hypoxemic at all, not one bit, okay? He actually looks like, to me, he's ready to go home. So just one more quick just overview of the general survey, the things that you need to mention, the things that your instructors are going to look for you to mention are just the patient's general appearance. He appears well nourished. Obviously he's a male. He looks appropriately his age, alright, because I've looked at his chart and I've seen that he's 44 years old. Actually, he looks a little bit younger than that, so that's a good thing. He is calm. He's not anxious. He's not in any apparent distress. I haven't actually talked to him yet, so I don't know if he's confused or oriented, but I'm going to guess that he's oriented. He's sitting up in the chair as opposed to lying in the bed. He's on room air, no oxygen. He has no IV drips, no IV fluids infusing. So my snap judgment, my 60-second assessment on Michael is that he is not sick. Alright, so that's the general survey. That's the main points that you need to hit with that general survey. Okay, and everybody does that. That's the first thing that I do when I walk into my patient's room. I'm looking around the room, right? How many pumps do we have? How many, what kind of oxygen are we on? That sort of thing. Alright, so moving on to the subjective assessment. Now, I will have to tell you that this, like as a nurse, this is my least favorite part of the assessment, because as a student, I'm getting better at it now, but as a student, you know, you'll find that your patients really want to talk to you, and that's great. But you as the nurse, you have to get to the most important pieces of information, and you only have a certain amount of time to do that. Alright, so when you're asking these subjective questions, try to really keep your patient focused on the main problem, okay? I, as a nurse, am not concerned with the fact that Michael had pneumonia 20 years ago, all right? And I don't need to hear a 15-minute, story about that. That's not relevant to why Michael is in the hospital at this time, all right? So that's my biggest piece of time-saving advice for y'all, is try to keep your patient focused on what is most important. So you therefore have to figure out what is the priority and what you need to focus your time and attention on. You're going to hear that word a lot, the focused assessment, meaning if your patient comes in with cardiac problems, you're really going to focus your assessment on the cardiac system. If they come in with respiratory problems, you're really going to focus the assessment on the respiratory system. All right, so the subjective assessment for Michael, his chief complaint is abdominal pain. All right, so that's the chief complaint. So what I'm going to do when I go in is I'm going to ask him to go more into detail about the chief complaint, and that is going to be the history of present illness. All right, so those are two terms that you need to familiarize yourself with. So since his chief complaint is abdominal pain, and you know that we use the PQRST method to assess pain, I'm going to do that now. I'm going to assess his chief complaint first and then move on to the rest of the subjective data. All right, so Michael, the P, which is provoke, does anything make your pain worse? Any activity or any food that you eat, anything at all?
Not particularly, no.
Nothing makes it worse. Okay. Then PQ, the Q is the quality. So how would you describe your pain? And you can use different describers such as dull, sharp, stabbing. Those are quality describers. So
I would say it feels more like a sharp stabbing pain.
So a sharp stabbing pain. All right, so that's the PQ. Then the R is radiating. And radiating means, does the pain move around anywhere else? Do you feel the pain anywhere else in your body?
No.
Okay, good. And then the S is going to be the severity. So have your patient rate their pain on a scale from 0 to 10, with 10 being the worst.
Probably a 6.
A 6. All right, so that's pretty severe. And then finally, the timing. So how long has this pain been going on?
Probably off and on for about 3 days.
Off and on for about 3 days. All right, so that is the PQRST method. Make sure you do kind of like how I did, because if you go in and ask your patient, what provokes the pain, they're probably not going to completely understand what you're asking. Make sure that you put your questions into the patient's terminology. All right. So that was the PQRST assessment of his pain, of his abdominal pain. Now we're going to move on to the rest of the subjective data that you're going to need for your clinical paperwork. You always ask about medications, and this is very important as the nurse, because if your patient takes any medications at home, the physician or the provider will have to look at and evaluate those medications and see if whether or not they are appropriate to continue at the hospital at this time. So Michael, do you take any medications at home?
No, I do not.
No medications. Well, I think he's lying, because that's a first. All right, so great. So next, to kind of keep your mind on track and give you an order to follow, when you ask about medications, the very next thing to ask about is allergies. All right? Are you allergic to anything, Michael?
Well, I think I may be allergic to like poison ivy and that sort of thing.
Okay. No foods or medications?
No, not really.
Not really?
Well, I don't think so. There's none that I can think of.
So you've never eaten a food or taken a medication and broken out in hives or had any kind of reaction like that you know of?
No.
Okay. So we would document that as no known allergies. All right, so the next part is going to be the family history, and this part is where patients can really get off on rabbit trails and start talking about great-grandparents, but really the most important people that are going to be part of the family history are mother, father, and any siblings. All right, so I'm going to first ask you about your mother. And what we typically want to know about in the family history is heart disease, high blood pressure, or cancer. Does your mother have a history of that?
No, she hasn't, as far as I know.
Awesome. And she is still living?
Mm-hmm.
Okay. What about your father?
He may take a blood pressure pill.
Okay, so he may have hypertension.
I guess so, yes.
And he is still living?
Mm-hmm.
Okay. Any siblings?
No.
No health problems, or you don't have any siblings?
No siblings.
You don't have any siblings. Okay. So that's a good family history. All right, so the next part of the subjective assessment, I'm going to just start asking Michael some body systems questions. And I'm going to start first with GI, which we've already kind of did the PQRST assessment, but I'm starting with GI because that is the system that I need the most information about. And if I run out of time, if I have to leave, if I get pulled out of the room for some reason or another, I want that information because that is the most important to what's going on with him right now. I hope that makes sense. All right, so we've talked about the pain. Have you had any other symptoms with the abdominal pain? Any change in bowel patterns?
No.
Any nausea or vomiting?
Not really.
Okay. No bloody stools?
No.
No diarrhea, constipation? No change in appetite?
Mm-hmm.
So basically you just have this ongoing kind of
off and on
sharp stabbing abdominal pain, and it's located
just right in the center.
Right in the center of his abdomen. Okay, so we would kind of document that as epigastric. All right, so that's right in the center. It's very important, especially with abdominal complaints, you know, that you ask them where it's hurting, because certain side could be the appendix, certain sides could be the colon. All right, so you need to know which side. Another thing I also want to know, especially with abdominal complaints, is any abdominal surgeries. Because if Michael doesn't have an appendix anymore, then it's not appendicitis, right? So have you had any abdominal surgery?
I had my appendix out when I was 16.
Okay, so we can rule out appendicitis. All right, so good. So that's a good GI assessment. Now I'm going to just start and work from the head down, all right? And like I said, we're not going to go into a whole lot of detail about the portions that are not just extremely pertinent to his complaint now. All right, so with the head, eyes, ears, nose, we always ask, do you have any problems with headaches?
Not really. Well, sort of. It seems like I might have had one or two.
One or two, but they don't come on more than once or twice a week, or?
Yeah, that's probably right. Once or twice a week.
Once or twice a week. Okay. What about any numbness, tingling?
Mm-mm.
Any history of seizures?
No.
All right. Any eye pain, eye vision problems? No. No contacts, glasses?
Oh yes, I do. I do wear contacts.
You wear contacts. Mm-hmm. Okay, that's something that the nurse would need to know, because we would need to make sure that he had all his contact equipment with him for his hospital stay. Any ringing in your ears?
No.
Okay, that's tinnitus. Okay, but instead of asking the patient, do you have any tinnitus, because they would look at you like you have two heads, ask them if they have ringing in their ears. Something else that's very important, and it's not going to be extremely pertinent with a 44-year-old male, but with your older patients, you definitely need to ask them if they have any trouble swallowing. So we need to know if they need to be on aspiration precautions. And that's something else also that has to do with the GI system. So do you have any trouble swallowing? All right, good deal. So that's a pretty good, thorough neuro, head, eyes, ears, nose, throat. That's enough information that I need to know for abdominal pain. I'll move on to cardiovascular. And since GI and cardiovascular are kind of closely linked, we'll ask a few questions about that. Have you had any chest pain?
No, none.
The pain has not moved up into your chest area at all whatsoever? Okay.
No.
Have you had any palpitations?
What's a palpitation?
Where your heart feels like it's kind of beating out of its chest and you can feel that it's beating irregularly.
No. Mm-mm.
Okay. Do you have any trouble with your blood pressure?
No.
And you've never had to have any, take any medication for any kind of heart condition?
No.
Okay, great. So the next part's going to be respiratory. And we're going to ask, have you had any shortness of breath at all?
No.
Have you ever dealt with any shortness of breath?
No.
Have you had a cough? Mm-mm. Okay. If they did respond that they had a cough, you would ask if it was productive or non-productive and about the appearance of the sputum. All right, so we're going to skip over GI. We've already done the assessment on GI. Moving on to GU. Have you had any change in urination patterns?
No, I have not.
Difficulty urinating?
Nope.
Pain with urination?
No.
Any history of urinary tract infections?
No.
Okay, good deal. And then finally, I just like to ask a little about hematology. I guess probably because I like hematology. But do you find that you bruise easily or bleed easily?
No, I do not.
Okay. Do you have any history of diabetes?
No.
All right. Any family history of diabetes?
I think a grandfather had maybe the type, I don't know, the type that's onset, not from birth.
Okay, so your grandfather probably had type 2 diabetes.
I think he was able to control it mostly with diet.
Okay. All right. So and that was something that I forgot to ask about in family history. But that's usually about the only endocrine type question that I ask is diabetes. Sometimes if I think that I may need to know a little bit more about the endocrine system, some other systems you would want to touch on would be thyroid, especially with women, all right? Because women a lot of times will come in and they will have hypothyroidism, but he's on no medications, all right? So that gave me kind of a clue right there that he probably wasn't a diabetic. He probably didn't have hypothyroidism or any other issues like that. You want to make sure you ask about any kind of autoimmune diseases or anything like that. But like I said, with this complaint of GI pain, you kind of want to make sure you keep the patient focused on the main system, the main problem, the priority reason for this visit, right? So quick recap, we did the general survey. The chief complaint, you want to be able to differentiate those terms. The chief complaint was abdominal pain. The history of present illness is what he told us about the abdominal pain. That the abdominal pain was a sharp, stabbing, epigastric pain that would come and go, and it has been occurring for 3 days, I believe he said. And then your other descriptive factors would be the PQRST questions that we asked. And that would be the complete description of the history of present illness, all right? The past medical history, he takes no medications. He doesn't have any known diagnoses. So the past medical history for him would be really easy. For most of your patients, it's going to be about 3 pages long. He doesn't have any allergies, which is great. He doesn't have any trouble swallowing. He's probably not going to need aspiration precautions. And one other thing that you're going to need to know for your clinical paperwork for sure is their code status. And Michael is a full code, and so that would be something that you would need to make sure that you ask. And the last thing I forgot to mention is almost to fall precautions. If your patient is on fall precautions, document that. All right. So that kind of wraps up our general survey and our subjective data. I hope to get a couple more videos out covering different parts of the actual physical assessment, where you'll see me put stethoscopes and use my pen light and everything on a patient. Go ahead, if you're watching this from YouTube, head over to thedoctornurse.com. Check out all the awesome resources. There is a health assessment checklist that I have posted on the website right now, and it just gives you a real quick overview of what all you need to assess with each body system. So I think that'll be a real neat tool that you'll find. Go ahead and hit the subscribe button for my YouTube channel. And I just thank you so much for watching. I hope you have learned something, and I hope to see you on my website very soon. And thank you, Michael.
You're welcome.
First walk into the room, okay? There are a lot of conclusions that you can make. There are a lot of things that you can...
She's in the...
subjective data that you're going to need for your clinical paperwork. You always ask about medications, and this is very important as the nurse, because if you're... Thanks for getting a thumbs up for my daughter, Grace. You go back over there to your pillow, baby doll. Alright, so